So now I'm going to introduce this evening's speaker. So we are joined by Dr. Remya Salimkumar. Dr. Salimkumar is a BSMS graduate and current Psychiatric Clinical Teaching Fellow. Her South Indian roots sparked her passion for Ayurveda, which she explored further during a 1 month elective in Ayurvedic medicine. And as an undergraduate medical student at BSMS, Remya worked as a mentor on the Bright Med and Bright Ideas programs, and she also recently returned to interview candidates at BSMS during our admissions process earlier this year. So Remya, thank you so much for being with us tonight, and I'll hand over to you.
Oh, thank you so much for that introduction. I'm just going to share my screen. Um, okay, so starting off with a Mentimeter, hopefully, guys, I'll show you the slide in a second. So, as Agatha kindly said, my name is Remya. I'm a current psychiatric teaching fellow and working in Millview Hospital in Hove. Um, the outline for this session is I'm going to be talking about what even is medicine, really, and then going on to what is Ayurveda. I'm going to talk a bit about my own experiences with Ayurveda and why I'm interested in this at all. Go through two key Ayurvedic concepts, and there's many different concepts, and it's hard to kind of summarize it all in one hour. But I'll explain two concepts that I like, and then a bit of comparison between Ayurveda and modern medicine, some evidence that backs Ayurvedic medicine, as well as some controversies, and we'll finish on some final reflections. But just to start off, I'd love to get an idea about who's in the audience today. You can join the Mentimeter using the code or using the QR code or the code itself. So when you're ready, I can see a few people are responding. It's great. We can see a lot of 16 to 18-year-olds have joined, which makes sense. Obviously, you guys are thinking of applying to medicine, and hopefully, this will kind of give you a different taste of what medicine can include or different adjuncts to medicine that you might not have learnt about. It's great to see a bit more 14, 16-year-olds, some older people as well. So great. There's quite a big range of people here. I'm going to move on to the next question. So, where in the world have you joined us from? I know this has quite a wide reach, these talks, so it'd be great to know where you're all from. Okay, so we can see mostly UK based. That's great because I guess it's just newly coming to the UK. It's been around for a while, but it may be more so in London. So it's definitely something that you might have experience with, you might not, but being in the UK, it's less common here. So hopefully I'll do the talk justice. Fine. I'd love to know how much experience you guys have with Ayurveda. Maybe some of you have never heard of it before. Maybe you've heard of it but never actually tried it. Maybe you've practiced a little bit of it. Maybe you practice it often and daily, in which case you probably know more than I do. And maybe maybe you might find a better talk out there. Okay, this is interesting. So most of you haven't heard of it. And that's quite interesting to see. It's nice to see some of you have heard of it at least as well, and hopefully I can build a bit on to that knowledge as well. Okay, I'm going to move on to the next question. And just starting off as a quick poll. I know most of you haven't heard of Ayurvedic medicine yet, but do you think Ayurvedic medicine should be offered for free on the NHS? Okay, lovely. So most people aren't sure. Some people are saying yes already, which is exciting considering some of you haven't even heard of it. So it's really nice that you're open-minded to actually know what it is and be open to something being available because people know it helps others at least, even if they don't know what exactly it is. Okay, I'm just gonna skip to my share my PowerPoint now. Okay, so fine. So before we even define what Ayurvedic medicine is, it'll be helpful to define what medicine even is. A general definition is that, so I'm just going to move. Yeah, okay, cool. So, a general definition is that medicine is the science and practice of caring for patients. It can involve preventing illnesses, diagnosing disease, treating conditions, easing suffering, and promoting overall health. So, most people will be comfortable with the idea that medicine is hospitals, doctors, prescriptions, treatments. This is what we're kind of raised believing it is. But is medicine only pills and injections, or is exercise also medicine? Is sleep medicine? Is therapy medicine? Is food medicine? Is a hug medicine? You know, they say laughter is medicine as well. So I think medicine can be considered quite broad. And what if medicine is anything that just helps to reduce suffering or improves health? And I think what I like about Ayurveda and what draws me to Ayurveda is that it has a very broad concept about what is considered medicine. So Ayurvedic medicine is an ancient Indian system of medicine. It's one of the oldest systems we have that focuses on holistic health, and it emphasizes the balance of body, mind, and spirit to maintain wellness and prevent disease. It's more than 5,000 years old, and it traces back to the Indus Valley civilization. You'll find a lot about it in the Indian and Hindu scriptures. Thinking about the word Ayurveda, it's actually made up of two separate Sanskrit words. So the first is Ayus, which means life or longevity, and Veda, which means knowledge and science. So together, it's the science of life, or it's the knowledge of life. And there's loads of different components of Ayurveda. This could include herbs and remedies, or I guess in modern world you consider it as medications, or it can include daily wellness practices, so your lifestyle. There's different therapies as well, and we'll come on to that a little bit more detailed in a second. So there's so many different aspects of it. So some of the common Ayurvedic herbs that we use, and they have different benefits, all of them. The ones that perhaps you might be a bit more commonly aware of is ashwagandha. This is becoming more and more popular recently, and this is thought to help with sleep, cortisol, stress as well. There's also turmeric, and turmeric has kind of peaked in the modern world in the last few years. You will see even in Starbucks and Costa doing turmeric lattes and really talking about the benefits of this. And it's not just kind of India's secret golden syrup anymore. It's really now worldwide. And there's a lot more evidence to back it. But as you can see, this is a very short list. There's a lot more other things that can be used to help promote wellness. There's various different Ayurvedic practices. I've kind of kept here just the top three that people use more. So there's a lot of oil massage, and usually it's coconut oil that people use, castor oil as well. And that can be someone else massaging you. And certainly Ayurvedic head massages are very popular for good reason. I highly recommend. But even just self-massage is also important. And even if you're just doing it to yourself, that still counts as Ayurvedic medicine. One thing that's become a bit more common, I've seen a lot more on the Instagram and TikTok polls, is oil pulling. So you take a spoon of usually coconut oil, swish it around your mouth, and it's thought to pull out the bacteria, and then you spit it out and get rid of all those toxins. So that's becoming a little bit more common too. And then there's Shirodhara, which is the picture shown here, where warm oil is poured over your forehead, and this is meant to help with it can help with headaches, migraines, stress, anxiety, sleep as well. So maybe some of you have had experience with that, and if not, I highly recommend because it's very relaxing. Then there's other lifestyle, body, mind practices. And here's a lot. There's a lot of things that Ayurveda says this is good for you. The ones that I think might be a bit more common is tongue scraping, especially with a copper scraper. Yoga, even though it's not necessarily purely Ayurvedic, it's got an influence from a lot of different areas. It's very integrated within Ayurveda. There's also pranayama, which is breathing exercises, and there's many different types of breathing exercises that you might find. Various different meditations, yoga nidra as well, which is one that I personally prefer. I'm not very good at meditating alone. I get quite easily distracted, but yoga nidra or body scan involves focusing in on different parts of your body in a sequence. So you might start off feeling your right thumb, then your right index finger, then your right middle finger, and you keep going, your right hand, your right elbow, and slowly, you put all your focus there. And it really helps you focus in. And personally, for me, I have ADHD, so I get very distracted, but this is a great way to focus in. It's also one of the few meditations where it's absolutely okay if you fall asleep. A lot of people do this before they go to bed, and this is what I mainly use it for as well. And then you have mantra chanting as well. So whatever mantra it is, a lot of mantras within Ayurveda is based on Hindu kind of mantras or specifically towards different gods, but you can use it any mantra you want. You can say things like, I am safe, I am happy, I am loved, etc. And so, even though a lot of you said you've never heard of Ayurveda and you've never practiced it, you probably have practiced one of these things before. And so, all of you in this room probably has practiced Ayurvedic medicine or been an Ayurvedic yogi themselves. So, well, I'll come back to that poll at the end and see how your answers have changed. So I'll start off with, I'll go on a bit about my own experiences with Ayurveda. And really, my experiences started at birth. I'm from a South Indian background. I'm from Kerala, and Kerala is often thought to be the birthplace of Ayurveda. And we start quite young. We, from babies, even from 1 month old and so on, we massage them with either sesame or coconut oil. And whilst I can't remember myself being massaged as a baby, I certainly have seen my nieces and nephews and cousins being massaged from a young age. And it's thought to be that there is evidence that shows that infant massage strengthens the maternal attachment, and it can also increase body weight and height in infants, which is good for infants. That's so good for adults. I'm sure less people would want massages if that was the case. But yeah, it's shown to have benefits, and it starts from a young age. And I think initially when I saw other people having, I thought that's really weird. You're massaging a baby, but actually there's so many benefits to it. And then I think what really kicked it off, between birth and 16, I had my mom telling me about various things and buying me various supplements, helping me get better at school, etc. But I think I naturally had my interest around 16. When I was 16, I'd get a lot of styes, so I'd get a lot of eye infections for whatever reason, and a lot of the modern medicines didn't really work for me or didn't work quick enough for me. But somehow I came across turmeric eye drops, and you essentially get some boiling water, put some turmeric inside, boil it off, and then you end up with the paste that you could put on the outside, but also eye drops that you put in the eye. And genuinely, my styes would be gone within 2 days max by doing this. And that was the first time I was like, wow, this is amazing. This is a household item that I have that is doing wonders for me, doing better than what modern medicine was doing for me at that time. So that's when I first was like, wow, this is an amazing thing. Um, then going forward, around 19 and onwards, when I started uni, that's when I started getting into yoga nidra. But it's also when I started getting a lot of pain, probably sitting in front of the laptop, sitting in lectures all day. I'd get really bad posture. I'd end up getting neck pain and hip pain, headaches, etc. And I started doing acupuncture and dry needling at that point, which really, really helped, obviously in collaboration with exercise. But throughout that time, I've always had a bit of an interest, and it's kind of been little droplets of information coming from various aspects. But I really started kind of putting more effort into it when I did my elective. And so, for people who don't know what an elective is, at the end of your medical school training, you get usually 4 weeks to go off and do whatever you want, whatever interests you to do with medicine. And so I was keen to do Ayurvedic medicine at that point. And so I did 4 weeks in Sri Lanka, in the south of Sri Lanka. Even though Ayurvedic is a very Indian practice, it's very popular in Sri Lanka. I'd say even more so popular in Sri Lanka, if anything. And this was me with the Ayurvedic doctor that I sat in with. This is just beautiful pictures of Sri Lanka, and it really is a beautiful country. And these are a few kind of examples of things we saw. So this video here is the acupuncture that she very kindly gave us all a taste of. And for those who don't know acupuncture, you might have heard it more in a traditional Chinese medicine sense, but it's the idea that illness and pain occur when the body's qi or prana in Ayurveda, it cannot flow freely. And so you insert really fine, sterile, single-use only needles into specific acupuncture points, and this kind of reestablishes the free flow of qi to restore balance and trigger the body's natural healing progress. The bottom picture here with the hand is from one of the doctor's medicine books. And so in Ayurveda, they talk about marma points, and this is 107 different anatomical sites that are mapped across the body in classical Ayurvedic texts. And it is one of the oldest systems of body work that's been in recorded medicine. And marma points are junctions where multiple tissue types converge. So you might have muscles or ligaments or whatever it is meeting at specific points where energy concentrates. And this isn't energy in like a speculative sense. It's actually anatomically identifiable sites where the body's physical structures or circulatory pathways or neural networks intersect. So a lot of this might influence where you put your needle or where you massage. The picture on the top is just where she worked from. It was really a very small room. People come in multiple times a day. It was a very hot room as well, which I quite liked. But it's nothing fancy or anything like that. It was just a simple room. Then we've got yoga on the top right. And then at the bottom, one of the things that I found very interesting that I hadn't been exposed to until my elective was pulse reading. And you might be aware, obviously, you might be able to already. Obviously, we read the pulse to have an idea of your heart rate and whether your heart rate is regular or too fast, and you use your two fingers. Ayurvedic medicine does something very interesting where they use three fingers, and this is to read the doshas, which will come, I'll speak a bit more about. But essentially, it's a way to kind of understand how your energy is doing, and on a superficial level, they can understand a bit about what your diet is like or what your emotional state is like. In a more in-depth session, they might have a bit more understanding about how your digestive or metabolic processes are doing. And in the deepest sense, they might find out about more chronic conditions. And I saw this woman, this doctor, doing pulse reading for the multiple people and being quite accurate about it. You know, she'll say things like, do you have digestive issues? Or I can sense that even though you're really smiley, you're having thoughts of lowness and difficult thoughts and stuff. For me, she said that I have a very clear mind and various other things. But yeah, she was quite accurate and it was really interesting. This is something that I've never seen before and would not believe could be a thing. And of course, I go about everything with a sense of skepticalism, but it was very interesting to see how she was actually accurate for at least 7 people that I saw. Fine. And beyond the herbs and the treatments and the practices, Ayurveda is also about philosophies and concepts, though. So I'll explain two of the concepts that I liked. So concept one is about the 4 types of life you might live. So it's thinking very much what kind of life are you living? Ayurveda doesn't just ask, are you sick or not? It's asking, what kind of life are you living? What choices are you making? So there's 4 kind of types of lives you might be living. One is hitayu, which is a beneficial life. And this is thinking about making healthy, ethical, balanced choices that are good for you and others. So this can be about your physical health. You know, you might be choosing to go to the gym however many times a week. Mental clarity, might be choosing to meditate. It's about emotional balance, but it's also about how are you treating other people? Are you making good choices? Are you being nice to other people as well? Then we have the opposite of that is ahitayu, which is a harmful life. These are things that damage your health or goes against your body's needs or are unhealthy habits. So here we have examples of poor sleep, constant stress, overworking, and this is quite standard for a student. And so we're not making the best choices really sometimes. We also have Sukhayu, which is a happy life. And this is a life of comfort and ease and emotional well-being, financial safety, lack of discomfort. And you know, you can have Sukhayu without having Hitayu. You know, you might be eating junk food daily and that feels good, but on the long term, it's not very beneficial. Then we also have Dukkhayu, which is a life of suffering, and this can include poor health, chronic stress, emotional distress, and a lack of purpose. And it's not just about disease, it's about imbalances across your life. And again, how are you living your life? And I think the aim is obviously to be closer to Hitayu and Sukhayu, making choices to bring you towards those lives. But I think what's quite interesting is whilst modern medicine does ask us to make good choices, you know, modern medicine does say exercise, diet, sleep 8 hours and at regular times, etc. I think what's really interesting about Ayurvedic medicine is that it's asking, are you a good human as well? Do you feel like you have purpose in your life? And certainly in psychiatry, for example, where social history is so important, you know, Are you married? Do you have good relationships? Do you have a job? And we can see how, if you don't have a job, for example, or you're in a distressing relationship, we can see how that can affect your mental health. Me as a psychiatrist, I'm not even asking, do you feel like you have purpose in life, or do you feel connected to your community? And these are very vital aspects to feeling good in yourself. And if you feel good in yourself, you feel good in terms of your physical health as well. And these kind of questions don't come up in modern medicine. And I think it is quite important. And we know in psychiatry, for example, that a lot of elderly people become depressed when they retire because we take away their sense of purpose and we don't replace it with something else. So these are important questions that modern medicine isn't really asking right now. So I think that's quite an interesting concept, and it's very easy to look at well, not very easy. It's important to look at your life and think, am I making choices that help me have a beneficial and happy life? Going on to concept two, which I think is one of the main concepts that people consider within Ayurveda, is about doshas. So before we get to that, we'll talk about Mahabhutas. So this is suggesting that everything in the universe, including us as humans, is composed of five fundamental elements known as the Mahabhutas. These five elements are water, earth, fire, air, and space. And if anyone here watches Avatar: The Last Airbender, you'll identify the first four elements, and these four are quite often talked about. And then space is the drawing I made myself, and I'm quite proud of that one. But these are the five elements, and it's thought that these five elements make up everything in the universe. And they combine in specific pairs to create the three doshas. And doshas are fundamental energy in Ayurveda that governs a person's physical, mental, and emotional characteristics. Essentially, doshas are things that can go out of balance. So there's different combinations. So if you get space and air, you get vata. If you get fire and water, you get pitta. If you get water and earth, you have kapha. What does this mean? So we're all made up of three different doshas, and these are just different ways that energies interact with each other, but you may have one that's more predominant than the other. And essentially, it's about patterns. It's patterns in your body type, your digestion, your energy levels, your emotional tendencies. And Ayurvedic treatment and advice is based on all these doshas. And whilst modern medicine might take into consideration that people with a different age, height, gender, ethnicity might have differences in how they respond to certain treatments or certain exercises, it doesn't quite take into account the fact that you can have two of me, you can have two 29-year-old, quite small Indian females that are both eating and doing the same, but have actually different outcomes. I feel like Ayurvedic medicine does go a bit more deeper into the personalized medicine. So I'm going to make it a little bit practical here, give you a bit of time to work out your own doshas. I'll give you about 3 minutes to work that out. Hopefully that's enough time. And then I'll check in and see what you guys found yours to be. So it'll be 3 minutes of silence. And just to note, this is not a diagnostic test at all. This is a very quick, fun version of it. It's not a medical assessment. If you want to know more about it, there's more in-depth quizzes that you can do. Okay, hopefully that was enough time. I'm just gonna stop sharing and open the Mentimeter again so you guys can see what everyone came out as. Okay, this is quite interesting so far that we have a lot of people that are Pitta. I'm personally Vata Kapha mixed. And I know a lot more Kaphas than I do know Pitta. So it's very interesting the spread across here. I'm gonna just stop sharing and go back to the PowerPoint. Um, And do feel free to take a screenshot of this if you want to look at it more detailed afterwards. But as I said, there's a lot more other more detailed ones you can find online as well. So speaking generally, the three doshas, they have kind of different purposes, I guess. So Vata is thought to be movement and movement in the body. So thinking about breathing and circulation. People who are more Vata dominant tend to be quite creative and quick, but they can become quite anxious or scattered when their doshas are imbalanced. And these are people who tend to overthink before exams or have quite irregular sleep. The people who are Pitta tend to, this is more about transformation. So Pitta is responsible for digestion and metabolism, and these people tend to be quite focused and driven. That makes sense while you're here on a Wednesday evening learning and expanding your knowledge. But they can become quite irritable or quite overly competitive. And these are people who get frustrated when things aren't efficient, or they might be quite hangry people. And then Kapha, this is about structure. So Kapha is known for stability and strength. They can be quite calm and steady, but they can be quite sluggish and unmotivated when imbalanced. And these people can find it harder to wake up or tend to turn to comfort eating. So maybe you relate to this, maybe you don't. It's all very much changes, it's all a balance, and it depends on what stage of your life you are and what daily habits you're doing to kind of influence them as well. So the doshas is not inherently good or bad or anything like that. The problems that arise happen when one is excessive or unbalanced, or when your lifestyle doesn't match your constitution. By constitution, I mean your unique makeup of these doshas in percentages or how much it is. So, for example, for the Vatas, if you're a Vata, you're predominantly Vata and you have no routine, you tend to be more anxious. If you're Pitta and you're constantly in competition, you tend to burn out easier than others. Kapha, if you have more inactivity, you get quite lethargic. And there's various different advice based on your dosha, and you can see a few of the examples here, but we'll go through them as well. So Vata, they advise that you should focus more on warm, moist foods like soup, stews, cooked grains, and avoid the cold and dry foods like raw vegetables. And that routine in place and some gentle exercise, warm oil massage. Pitta, so they suggest cooling and hydrating foods, so thinking about cucumbers, etc. Avoiding spicy, oily foods. So I'm very glad I'm not Pitta because I love my spicy food. And they suggest cooling activities or meditation and overheating. Um, Kapha is known to, they should do better with light, dry, warming food, and it's suggested to avoid heavy, oily, and sweet food. And active movement or invigorating routines are recommended, as well as dry brushing. So, thinking about Ayurveda versus modern medicine, I think there are a few differences. Both, well, there's a lot of similarities first, though. Both aim to reduce suffering. Both want to treat disease, improve quality of life, and seek ways to prevent illnesses. They just go about it slightly differently. They both recognize that lifestyle matters. And they both do use natural substances. It's often thought that traditional medicine is the one that uses natural substances, but a lot of modern medicine does as well. So, for example, aspirin is from willow bark. The difference is about standardization and the testing that's done on these medications, not whether nature is used at all. Both reject a one-size-fits-all approach. Certainly in the last few years in medicine, when I was going through medical school, there was a lot of emphasis on individualized or personalized medicine. Ayurveda was doing this very much from the beginning. So modern personalized medicine is seen as this new thing, but actually we're going back in time, we're going backwards. And it was always a thing that was considered in older, more traditional medicine. In terms of the differences, there's just a difference in approach. So modern medicine is a bit more disease focused. It's, you go to the doctor when you have the illness and then you get the treatment, whereas Ayurveda is very proactive. You go there to prevent the illness happening in the first place. Modern medicine identifies a specific pathology and then targets that disease directly. Ayurvedic is very imbalance focused and it looks at different patterns that you have and aims to restore balance. The main difference here is about evidence base. Modern medicine is based on large clinical trials that are trialed and tested. There's a lot of regulation and a lot of standardized dosages, which is very important. Ayurveda is based more on observation, thousands of years of observations. And whilst there are some studies coming out to support certain herbs, most of the treatment lacks any large-scale trials. But there is some evidence out there. So, for example, turmeric is one of the most widely evidence-based herbs out there from Ayurveda. So there was one study that had a meta-analysis using randomized control trials. And for those that don't know much about research, randomized control trials are kind of the best that you can get because it makes sure that all the factors are considered. And meta-analysis is a great way of seeing if there's enough evidence across different studies. So multiple studies have shown that turmeric does reduce levels of inflammatory markers and does significantly improve antioxidant activity. And this might be beneficial for diabetes, pre-diabetes, thinking about osteoarthritis as well. It's also shown that turmeric can also significantly reduce body weight. So we could see there's a range of different benefits from this and potentially many different diseases that might benefit from this with no side effects because turmeric doesn't have side effects. It's natural for you. It's good for you unless you're allergic, of course. But on the whole, there's no downsides of having this. So when you're comparing this to other medications, so if you think about osteoarthritis and you're giving someone medication like naproxen, it's known to be quite harsh on your stomach, for example, or on your kidneys. So there's different medications that we have in modern world that have side effects and turmeric doesn't. So if we know that it's having these effects, why not go for that? And then we've got ashwagandha, which you may have heard, you may not have heard. This is found to be very therapeutic for alleviation of stress and anxiety, and also reduces morning cortisol, which is known as the stress hormone. So as you can see, there is various different evidence base. However, a lot more research is needed, and there's a lot more herbs and treatments that we haven't even touched yet. We haven't even started doing research on. And then on top of that, we haven't really been comparing Ayurvedic medications versus modern medications. We haven't compared, for example, ashwagandha versus an SSRI like citalopram and seen what the difference is there. So a lot more research is needed. We're just starting it off. But I think it's important to think about how just because there's no research to back something doesn't mean that it doesn't work. It just means that research needs to be done, and we haven't gotten there yet. You can only kind of slate something once the research is done and shown it to be ineffective. There are some controversies regarding Ayurvedic medicine. One of the main things is about metal toxicity. So a lot of the herbal preparations might include lead or mercury or arsenic, which is proven to be harmful. Not that necessarily these are meant to be in there, and you certainly can take it out, but there's a chance of potential toxicity. And what they're finding is there's inconsistent manufacturing standards, so different companies use different amounts, and quality varies by country. So there needs to be better control over this, better regulations. There's also the claims of cures. So some people might go around saying Ayurvedic can cure cancer, can cure this, and there's no evidence to back that, even from observation. And certainly Ayurveda should not replace emergency or critical medical care. It certainly does have a place, I believe at least, but it's important to know what that place is and where it should work with modern medicine. So in terms of final reflections, I think the main thing is being open-minded. I've certainly found across the years, I'm quite open colloquially with family, with friends about my interest in Ayurvedic medicine, and certainly with certain patients, I will discuss this as well if they ask me about it. Not that I give advice or anything, because I'm not, as I said, I'm not an Ayurvedic practitioner, but a lot of my patients and friends and family appreciate the fact that they can even talk to me about it, because so many people are afraid to talk about it because they don't want to be seen as a hippie or silly for even considering it. And they're shut down immediately. And I think just being open-minded and giving your patients the chance to talk about it and seeing what they're doing and what is helping them and being encouraging about that is really important to build that rapport between you and your patient. Ayurveda is not, it's very much about awareness. It's about how well do you know your own body, and that's important regardless of whether you believe it works or not. We all can do to introspect a little bit and see what we're doing to help ourselves. It shifts the focus from disease to daily life and daily habits and daily practices and thinking, how can it work for me? And it emphasizes individuality. And this goes in various aspects. There's way more to Ayurvedic medicine than what I mentioned and what I would be even able to cover in this lecture. And finally, it's a great adjunct to modern medicine. I think in the same way we offer physiotherapy or we've got chiropractors, etc., etc. I think it's a great adjunct to modern medicine, and certainly if it helps you and there's no side effects or downsides to it, why not encourage it after all? So we'll go back to our poll and see whether that has changed anything for you guys. So first, how much experience do you guys have with Ayurveda? Have seeing what Ayurveda actually is, does that change anything for you? Yeah, no, that's very interesting. Let's go back and see. So we had 25 people saying never heard of it before, and now no one has said they never heard of it. You guys have practiced Ayurveda, so that's it's really nice to see that. Actually, what part of that is showing is that there's a lot that we do in modern day life, that's good for us, or maybe not good for us as well, that have roots that we're not giving credit to, really. But yeah, it's nice to see that you guys are practicing, and maybe you can incorporate it a little bit more as well. And then the final question again, do you think Ayurvedic medicine should be offered for free on the NHS? Yeah, that's changed quite a bit as well. So we'll go back. Where's that? So we had a lot of people saying not sure before, 22 people saying not sure. And now we've got 27 saying yes, and a few people saying no or not sure. So it's moved up a little bit. So that's interesting as well. So I'm going to stop sharing that one. Okay, and so oh, no, stop sharing. That is everything. I will just, yeah, thank you so much for listening. That was quite a quick one, but hopefully it was fun and just opening up what you can go explore further after.
Ramya, thank you so much. That was such a fascinating talk. And, I was one of those people who had maybe, heard the term before, but didn't really necessarily know what it involved. So I've really learned a lot. I was really kind of struck by your points about, it's this really personalized approach to medicine and health, and like really thinking about each person as an individual and made up of all of these different characteristics. And it's all about, it's about your body and but also your emotions and the type of person that you are. And I really, it was funny. I came out as Pitta, and I definitely identified with the hanger. That is definitely me. I can become very hangry.
That's
So yeah, thank you
interesting.
so much, Remya. We have got some questions in the chat, so shall we have a look at some of those?
Yes.
Brilliant. Okay. Um, so Mona has asked, has Ayurveda been added to the NHS already, or is it being added at any point?
That's an interesting question. As far as I've seen, no, I don't think it has been actually. I've never seen anyone refer someone for it or even signpost them to it. And quite frankly, I actually think a lot of even doctors don't know about Ayurvedic medicine or have awareness of traditional medicine as a whole. So unfortunately, not. I know there were discussions when I was in medical school about, should we bring in things like acupuncture because a lot of people find benefit from that, but I don't think that has been added on. as far as I'm aware. There might be someone else that might know the answer, but I don't think so.
Mm. Yeah, no, that's really interesting. I think it is definitely one of those things where it's sometimes that kind of advice, like, oh, acupuncture, it works for some people. It might be something you want to try. I know people who've kind of got that advice from their doctor, maybe. But like you said, maybe it's that thing about not having that same level of clinical trials and things. So maybe it's more
Yeah.
kind of feeling like, oh, it could help you. But I guess
Yeah.
it's really like we said, it's about the person and
Exactly, yeah. And I think that is the thing with the NHS. You can't really recommend anything until a clinical trial proves that it's good enough
mm,
for it. Um, so it is interesting. I mean, we do prescribe certain things, various different supplements, like multivitamins, for example, but we don't prescribe turmeric, even though there's a lot of backing for it. But yeah, essentially, it's just you can only prescribe things that are clinically proven. It's not there yet.
yeah, absolutely. Thanks, Ramya. Oh, we have an interesting question from Isabel. Isabel says, where do you think this could be implemented, particularly in the psychiatric field? And how do you think this could benefit modern medicine, perhaps more than current psychiatric support?
That's a really good question. I think especially in psychiatry, there's a lot of places where this can be brought in. And I think we are starting to do a bit more, I guess, soft medicine, I guess, in terms of we've certainly started making a move towards social prescribing and prescribing nature to patients and saying, I'm prescribing a woodland walk to you. And I think we
Mm,
certainly can do that here as well, especially certainly with massaging. Um, but also in terms of a lot of it is about what do you enjoy. And I don't think we sit down with patients enough and say,
mm,
what brings you purpose? What makes you feel like you're contributing to society? And I do feel like it's quite a slippery slope once you feel like you don't have purpose. And I think that's where we could be helping people. And this isn't just with Ayurveda. This is, in the Japanese culture, they talk about ikigai, and that's a sense of purpose as well. And it's starting to be talked about a bit more. And this is probably where like the OT can get involved. OTs do look at, okay, can we get you into volunteering groups? Can we find you a job? Find things that make give you structure to the day. But if we reword and say what gives you purpose to your day, that might be
mm,
helpful as well. I do certainly think, as I said as well, ashwagandha is proven to help with stress and anxiety. And maybe if
mm,
we've got people coming to the GP that are automatically put onto SSRIs, and they do come with bad side effects. It messes up your sleep, it messes up your libido, and that's important for your relationships. If we start prescribing things like ashwagandha that don't have these negative side effects, that might help someone that's at a very low level depression, and then bringing in the kind of the lifestyle part as well and helping them feel empowered. I think that could be very helpful at a GP level. Of course, it can never replace modern medicine. Some people do need the antidepressants. That's really important. But it's all working together, I think.
yeah, amazing. That really what you were kind of just saying then reminded me about the other bit that really interested me in your talk, which was kind of about I guess that modern medicine kind of sometimes might, to a certain extent, wait for the patient to arrive kind of already presenting with a condition or a disease or an illness. And Ayurveda is kind of, yeah, more about like how are you looking after yourself every day? How are you
Yeah.
finding that purpose in your life? So yeah, that's really great. Thank you so much. A great question from Isabel. Thank you, Isabel. Um, Agnes says, I would like to research into Ayurvedic medicine due to my cultural roots as well. Are there any kind of easy read books or resources that you might recommend?
I'm not a very good book reader. I'm, I'm very poor at reading books. I won't like most of my experience comes from just receiving it as a patient.
Mm, mhm,
I'm quite lucky where in London there are at least three Ayurvedic centers near me. So I would just go and say, I have this pain, help me out. I want this, help me out. And the same with there's a lot of more Chinese traditional medicine centers, I think, both in London, both in Brighton here as well, where I'm based. I think the best way is to just go and experience it. You can learn a lot from the books, but this is a very hands-on kind of medicine, I think. And I think the best way is to go experience it yourself. But certainly, like if you Google, for example, the doshas, just Googling what's my dosha, that comes up quite well. I did a very deep dive before going into ChatGPT and just asking what it is and what they advise my daily routine to be based on my doshas and going from there. But yeah, sorry, I don't have any books or any podcasts or videos, but I think, yeah, go out there and find a center and get yourself an Ayurvedic massage, I think is the best way.
I love that as a recommendation. I'm definitely going to look into that too. Thanks, Ramya. Um, okay, we have a question from Kakon, I think. Sorry if I'm saying your name wrong there. Um, do you think that if Ayurveda was to be implemented into the NHS, there would be some skepticism among the population? And how might you encourage others to explore new options?
That's a really interesting question. I think absolutely there will be skepticism, both from other patients or other, people in the community, probably from doctors as well. And we do know that persists to be the case regardless of what you do, even for chiropractic. I mean, there is less evidence for chiropractic, but um, there's various things that people will say it's just placebo. In my eyes, even
Mm,
if it is just placebo, even if it's just your mind playing tricks on you, why does it matter if it's making you feel better? I obviously spoke about my neck pain, and genuinely, my neck pain was completely gone after getting acupuncture. Would I do
yeah,
it again, even if I found out it doesn't work? Yeah, because it worked for me. It
yeah.
doesn't, for me, I think it doesn't matter how you get to the end product, as long as you're enjoying it and it works for you, even if there's no science behind it. Um, but obviously, the way to encourage people is by showing them the science, and the science is just starting to get there. Um, in terms of encouraging others to explore new options, I guess that's a hard one. Um, I feel like almost I would say I wouldn't bother. If people are open to it, it's definitely something that we need to make the avenues available and make the information available to them, but we shouldn't force people to find out because if someone goes in it with such a closed off mind, it probably wouldn't work for them either. Because your mind, as they say, your mind creates your reality. And if you go in saying it's not going to work, it's not going to work for you. If you say it does work, it will work for you.
Mm, yeah, I think that's a really interesting take from you. Thank you. Um, cool. Let's see here. Ariane has asked, during your elective in Sri Lanka, did you discover any Ayurvedic practices that may even be more effective than modern medicine?
Mm, it's hard to say because I was very much
Mm,
just enjoying being there and I wasn't thinking about modern medicine really. I was very happy in my Sri Lankan bubble. So it's hard to say if there's anything that works more effective. But what I will say, I think what we don't, I certainly feel that there's aspects of modern health that we're not thinking about, or modern living that we're not thinking about. So when I was in Sri Lanka, I felt the best I've ever felt because the food
mm,
there's very pure, it's very clean, there's no preservatives or anything. I was going to the beach every day, I was swimming in the water, and all these things are part of your health. And I certainly felt like I had less pain, I was digesting better, I was losing weight randomly as well. Everything was, my skin was better, my hair was better, everything was better. And I think there's so many different aspects of living that's important to your life that we don't really consider. And like, for example, I listened to a podcast called, The Psychology of Your 20s. It's a great podcast. And this is a lady that used to live in Australia, but recently moved to London. And for weeks now, she's had a cold or a snotty nose. And we know that London has poor air pollution, for example, and that's going to have an impact on your health. And so things like that, I think living in Sri Lanka essentially is what I'm saying is better than living in the UK for various different reasons that are kind of beyond our control now.
mm. Well, maybe that podcast is good recommended listening for people who want to just think about even if it's not specifically about Ayurveda, but just that kind of story is really interesting, right? Like you say, to kind of help us think about how health might be all of these different things.
Yeah.
Yeah, fabulous, cool. Um, um, Hossa has asked, is the elective a part of the medicine degree that everyone can do and every medical school offers?
Yeah, so every single medical student in the UK, after it's kind of like your rite of passage. After you finished your exams, usually most people do it in their final year after they've finished exams and they get to choose whatever they want to do. A lot of people do go abroad and do whatever their interest is there. So my elective was part Ayurveda, part psychiatry, part pediatrics, and it was very helpful to get another taste of what medicine looks like in another country. Um, some people do stay in the UK as well, and it's very much your chance to decide what you want to do and make it what you want. And yeah, every medical student gets to do it. Sometimes there's funding for it, and most of it is self-funded though. Yeah, but yeah, it's great fun.
Brilliant. Thank you. Um, mm, mm, mm. Loads of questions. I think lots of people are so interested in Remy in what you've been talking about. Uh, Tiana has asked, can healing ever be kind of fully complete, or is it always an ongoing negotiation with pain, memory, and suffering? And how does Ayurvedic medicine fit into that process of healing?
Yeah, I think that's a really interesting and very philosophical question.
Very.
I do think it's an ongoing process. Like especially thinking about psychiatry, for example,
Mm,
because obviously that's my usual. So thinking about PTSD or depression, etc., it's kind of you're always working towards keeping yourself healthy, and there's no point where you can go, okay, I'm fine now. I can go back to all my bad habits. You need to continue doing all the good habits in order to keep the pain, the emotional pain at bay or to keep it unmanageable. So I don't think it's ever really complete. I think it's
mm,
always ongoing, and that's why we have to make it habits instead of just doing it once and saying that's me done for the for my life.
yeah.
Um,
Yeah.
yeah, and I think Ayurvedic medicine's really good at that because I think it is looking at your daily practices. It's looking at how to make it work with your life and your personalities and your natural constitution, and how you can make that stick as well. Um, Whereas I do feel like sometimes, for example, you might be gearing up towards a surgery and they'll say you have to do this prior to the surgery and do this for a couple of weeks after, but what happens a year after? And they're not really talking about, you've had this major surgery, what should I do recovering from that later on? So yeah, I read is very much about daily life changes.
Mm, yeah. That's really interesting. Um, I think someone actually asked about surgery in the kind of Ayurvedic field. I don't know if that's something that you
Yeah.
kind of know about.
I have no idea. I have no interest in surgery, modern or Ayurvedic. But certainly when I was looking at it, I think what a lot of people within the field will say is that there's some places that cannot replace modern medicine. So things
Mm,
like surgery and emergency care, um, some of those things like Ayurveda cannot compete with modern medicine regarding modern medicine is
yeah,
more about long-term health as opposed to acute health.
that's such an interesting distinction, kind of long term and acute. Yeah, thank you. That's really helpful. And then we've got a question from um Jasitha, which is what ethical concerns do you think could arise if Ayurvedic practices were implemented into the NHS, and how might we address these concerns?
Yeah, I think the main concern is that obviously there's the concerns about production and making sure that it's all regulated. But I think the main concern is to get to the research part because you cannot treat someone with something that's not research backed. But even doing the research trials, for example, if we've already got evidence that sertraline works for depression and you want to see how it compares to ashwagandha and you don't know if ashwagandha is better, it's therefore not ethical by research standards to put one group with ashwagandha and one group with sertraline because it's being seen as giving someone less than. So it's hard to even get to that stage. It's the research part that has ethical concerns before even implementing it in the NHS.
Mm,
But this is again where I feel like the place for the NHS is it should be very patient-led. It should be me as a patient going and saying, I'm interested in this. Can you help me find answers? And I think that comes with the education for all staff to know these are options. This is where you can signpost your patient. Those are the main things that come to mind in terms of ethical concerns for me.
Mm.
Yeah.
No, that's very interesting to think about and a really good question as well from the audience. So thank you for that one. We'll just do one final question, I guess, then before we wrap up. We've got a question from Awina. Hi, Awina. What kind of formal training or qualifications are required to become an Ayurvedic doctor?
So I think most people who train do train in India or Sri Lanka, and it's kind of similar to tradition modern medicine as well, where I believe they've got a 5 year of either 4 or 5 year course as well, and you do have to be formally qualified to be an Ayurvedic doctor. You come out with a
Mm.
qualification, you're governed by a board, the same way doctors here are governed by the General Medical Council. I don't know what it is, but they are governed by a council as well. So yeah, you do need to get formal training. Of course, that doesn't stop anyone from learning. There are short courses you can do. So for me personally, I'm planning to do a 1 month Ayurvedic massage course later this
Mhm.
year. It's somewhere in India. So there are bits that you can learn, but to learn the whole thing and be an actual Ayurvedic doctor, you need a good 4 or 5 years.
Wow. Um, well, I am definitely going to go away from this talk tonight, Remya, and do a bit more learning and research myself. I'm gonna have a look at that. That ranking
Yeah, the
sheet that you gave
brochures.
us
Yeah.
again, and I really want to find out more about those and think about how I might go and practice some of these things in my life as well. So thank you so much for just a really fascinating talk and for giving up your time to come and be with us tonight. So yes, thank you so
Thank you
much,
so much. Thank
Ramya.
you everyone for engaging and showing curiosity.
It's been brilliant. Yeah, thank you to the audience for your great questions. Sorry we didn't get to absolutely all of them, but I think we had a really good mix there, some really interesting questions. And I can see some thank yous coming into the chat as well, Remy. So the audience, I think, are giving you a round of applause, even though we can't
Thank
see
you.
and hear them. Um, so yes, thank you everyone for being here. Have a good rest of your evening. Take care, and hopefully see you all soon.
Thank
Bye.
you.